Hello, my name is Laura Haro, and this is going to be my vital sign assessment. Let's go meet our patient. Hello. Okay, I'm going to close this for privacy. Is that all right?
Yes.
Okay. Okay, hello, my name is Laura Haro. I'm going to be your student nurse for today, and I'm going to be taking your vital signs. Is that okay?
Yes.
Okay, can I please have you state your name and then your date of birth?
Tofa Zargi, 02-14-94.
Perfect. And then before we get started, I did want to ask you some questions. Do you have any allergies?
No.
No. And then are you on any medication?
No.
Perfect. Have you had anything to drink or eat in the past 20 minutes?
No.
How about exercise? Have you exercised in the past 20 minutes?
No.
And then do you smoke or drink?
No.
Perfect. Okay, so I'm going to begin. Before I'm going to perform some hand hygiene, and I would put on some PPE, but since she is not needed in this situation because she has standard precaution, we'll just go ahead and use this. And then I already did sanitize and clean all my equipment, including my stethoscope, the blood clot, the oximeter, and then the thermometer with my timer. Okay, we're gonna begin taking your vitals. And then first, I'll start off with your oral temperature. Is that all right? This is gonna go under your tongue, and then you're gonna close your mouth for me. Okay. Open wide. Go ahead. Perfect. Okay, so I have your temperature as 36.6 degrees Celsius, which is completely normal. The normal range tends to be from 35.8 to 37.5 degrees Celsius. Next thing I'm going to do is take your pulse, and then we'll go ahead and do that. If you could just rest your arm. Okay, I'm going to locate your radial artery and start my timer, all right? Okay, so I got 72 beats per minute, which is completely normal. It's anywhere between 60 to 100. And then I also counted your respiration while I was at it, and I got 14, which is also in the normal range, anywhere from 12 to 20 breaths per minute. Okay, and then real quickly, if I can just get your index finger, this is to read your oxygen saturation. Go ahead and set it down. Okay, got 97, which is completely normal. It's anywhere above 95%. And then if I were going to assess her apical pulse, I would locate it on the left side at the apex of the heart, which is on the 5th intercostal midclavicularly. And then I would just go ahead and oscillate with my stethoscope for a full minute. Okay, so before we finish off, I wanted to ask you some questions. Are you feeling any pain today?
Yes.
Okay, and then could you tell me where you're feeling it?
I have headache.
A headache, okay. And then can you describe what you're feeling, the sensation of it?
It's kind of sharp pain.
Sharp pain?
Yeah.
Okay, and then when would you say this begun, the pain?
I would say 4 hours ago.
4 hours ago. And then is it coming and going, or has it been constant?
It's coming and going.
Coming and going. And then what were you doing when it started?
Studying.
Studying, okay. And then is it radiating anywhere?
No.
No, okay, so just
Same
that.
spot.
Okay. And then from a scale from 0 to 10, 10 being the worst, 0 being no pain at all, what would you rate it?
I would say 5.
A 5. Okay, and then what would you say makes it worse?
Loud noise.
And what would make it better?
If I warm my head a little bit.
Okay. And then is this affecting you in any way?
No.
No? Any other symptoms you want to tell me about?
No.
Okay, so it looks like that headache could result from the studying, you know, a lot of stress due to school. I would suggest you take study breaks, go ahead and rest, lay back. If you think the warm helps you, just put a warm towel over you. Avoid the loud noises. Okay, so we got all the vital signs. I'll go ahead and document this. I'll go ahead and clean all my equipment by sanitizing everything and also perform hand hygiene. The bed will be at the lowest position, and then I'll raise the side rails for her. If you need anything, let me know. To follow along with the apical pulse, I did want to add that you would use the apical pulse instead of the radial pulse in case it had an irregular pulse. Other people could count for a minute with the radial pulse, or you can also confirm your findings by doing an apical pulse. Since it is closer to the heart, it can be much more accurate and easier to hear.